Millions of Americans are missing out on critical health benefits because they don't understand the difference between Medicare and Medicaid. And the truth is, not knowing the difference could be costing you thousands of dollars each year. Here's the thing, Medicare and Medicaid sound similar, but they're worlds apart on who they help and what they cover and the peace of mind that they can bring. So you ready to control your healthcare? Let's dive in. So you're wondering, what's the difference between Medicare and Medicaid? Well, in a nutshell, Medicare is health insurance primarily for older adults, for people ages 65 and older, and people also with certain disabilities or conditions like ALS or end-stage renal disease can also qualify for Medicare. But by and large, the Medicare program is for older Americans in retirement. Meanwhile, Medicaid is a health assistance program that's primarily for low-income families or individuals, but also helps older individuals with things like long-term care. Now, the simple way to remember the difference is that think care means care for retirement seniors, while aid means aid for family with lower income or with income challenges. So if you qualify for both of these programs, you can enroll in both. Today, we're going to look at the 6 main differences between these two programs and why you should know about these differences, which I think is probably going to be pretty obvious to you. If you don't know the differences, you're not going to make the right decisions. So difference number 1 is who they are provided by. Medicare is a federal program. It comes from the federal government. This means that for the most part, it doesn't matter which state you live in. Original Medicare should be the same regardless of where you live because it's across the entire country. Now, if you decide to enroll in additional coverage for Medicare, which you have to do, by the way, such as a Medicare supplement plan or a Medicare Advantage plan, that's when things differ from state to state and even from county to county and city to city. Now, Medicaid, on the other hand, that is a joint federal and state program, and it is provided through your state. That's why things like eligibility coverage and costs and who can qualify, etc., vary slightly from state to state. The annual enrollment period is upon us, but it only lasts until December 7th. I always recommend that you shop for Medicare plans to see if you can save money or find new benefits. And if you want help, you can call us at the number on your screen and we will show your options at no cost to you. Okay, now back to the video. So whenever it comes to Medicaid, make sure you're checking your state-specific guidelines because they are not the same. The second difference is about eligibility. Now, we already know that Medicare is for older Americans primarily and people with certain disabilities, while Medicaid is for people on lower income and who have less resources. But let's take a deeper look. For Medicare, all Americans age 65 and older can enroll in Medicare. You can do this typically during your initial enrollment period, which usually starts 3 months before your birthday, the month of your birthday, and 3 months after your birthday. You can also enroll in Medicare if you have certain disabilities. So to qualify for Medicare through disability, you need to first qualify for Social Security disability benefits. And when you've had Social Security benefits for 24 months, then Medicare is available to you. And then finally, if you have ALS, which is known as Lou Gehrig's disease, or ESRD, which is end-stage renal disease, or known as kidney failure, then you also qualify for Medicare regardless of your age. Now, for Medicaid, eligibility is usually determined by your income. How low should your income be to qualify for Medicaid? Well, it depends. It depends on your state. Remember when I said that Medicaid is a joint federal and state program? This means that the states are free to set their own eligibility requirements. And you have to go by the eligibility requirements of your state. But to give you an idea, you can get into most states' Medicaid programs if your income is below 138% of federal poverty level. And I am talking about the part of Medicaid for health care. Remember that there's a part of Medicaid for long-term care for seniors that we'll talk about later. For example, let's say that you have a family of 3. The federal poverty level for a family of 3 is set at $25,820 in 2024. Good thing I wrote that down. And that means that if you make less than $35,631.60, you should qualify for most states' Medicaid program. Now, aside from families, you can also qualify for Medicaid if you're pregnant, if you have disability, and in some cases, you can qualify as an individual in a lower income bracket. Now, again, it all depends on your state. To find your state's eligibility requirements, you can go to Medicaid.gov. They have a directory there with all the state's Medicaid programs, so you can check that out. Okay, now let's talk about difference number 3, which is what exactly do these programs cover for you? And we're going to start with Medicare. Original Medicare is divided into two parts. There's Part A of Medicare and Part B of Medicare. In a nutshell, Medicare Part A helps you cover things for inpatient hospital visits, meaning going to the hospital. So if you're admitted to the hospital, Medicare Part A should help pay for your stay. And Medicare Part B covers you for visiting doctors and doing things in healthcare. Medicare Part A also covers skilled nursing facilities and hospice care. So like the recovery hospital, after the hospital, you go to rehab, that's going to be covered under Part A. So again, Part B covers outpatient medical costs like doctor's visits, preventive services, durable medical equipment, and really almost everything that your doctor deems medically necessary. So most of the stuff that you think of as healthcare, that falls under Medicare Part B. Now, it's important to note that original Medicare does not cover most prescription drugs. Most prescription drugs fall under Medicare Part D. And if you want prescription drug coverage, you have to enroll in a Medicare Part D plan or a Medicare Advantage plan, both of which are provided by private insurance companies and work together with Medicare, but are not from the federal government. Now, when it comes to Medicaid, the federal government has a list of items and services that all Medicaid programs have to provide, regardless of which state that you're in. This includes things like transportation to medical care, inpatient and outpatient hospital services, laboratory services and x-rays, nursing facilities, physicians, and some other mandatory benefits. You can find the full list, of course, on Medicaid's website at medicaid.gov. But aside from that list of mandatory benefits, states can add optional benefits or other benefits to their program, such as dental services, prescription drug coverage, dentures, glasses, and a bunch of other optional benefits. So make sure that you check with your state's Medicaid program to find out exactly what is covered, because just because a service is covered in one state doesn't mean it will necessarily be covered in another. Okay, now before I get to the last three differences, let me just jump in here and say that if you're finding this video helpful and interesting, please support our channel by leaving a like. We produce all kinds of great content, and more people should be listening and more people should be following. So please leave us a like and subscribe to our channel. Here's something that might shock you. Medicare does not cover long-term care. You'd think a program designed for older Americans would surely cover nursing homes and long-term care, but no, it does not. So where do you get coverage for long-term care? Well, you could have long-term care insurance. You could have your own resources, right? But since Medicare doesn't cover it, that's why people are looking for another solution. That's where Medicaid comes in. Medicaid does cover long-term care, and Medicaid is what fills in the gap for many seniors who don't have enough money when it comes time for them to receive long-term care, nursing care, etc. And according to Medicaid.gov, Medicaid is the primary payer across the nation for long-term care services. Now, of course, you still have to check at what exactly your state covers and your state's rules for qualifying for long-term care, and they can be different from state to state. But keep in mind, because of the fact that Medicare does not cover long-term care, it is something that really catches a lot of people off guard. So Medicaid is the program that covers nursing homes, nursing facilities, and long-term care services. Next up, we have costs. Let's talk about the costs of Medicare and Medicaid, because another common misconception about Medicare is that it's a free program, right? In reality, that couldn't be farther from the truth. First off, you have to pay for Medicare Part A. You paid for it the entire time that you were working. That is absolutely not a free thing. In addition to that, you have to pay a Medicare Part B premium for most people. And you'll have to pay co-pays and co-insurance every time that you get covered services. So for example, the base premium for Medicare Part B in 2025 is $185. And it also has a $257 deductible that you have to meet before Part B starts covering you. And then once you reach your deductible, you generally still have to pay 20% for most covered services. Now, it's probably fair to say that not having Medicare or any creditable coverage is a lot more expensive for you, but always remember that Medicare is not free to have, and it's also not free to use. That's why, aside from enrolling in Medicare, most people choose to enroll in either a Medicare supplement plan or a Medicare Advantage plan to pick up the costs that Medicare doesn't cover. Both of these types of programs, Medicare Supplement and Medicare Advantage, are provided by private insurance companies, and they both help you reduce your out-of-pocket expense when it comes to Medicare. However, over on the Medicaid side, things are pretty different. As usual, it depends on your state's program, but you're not going to pay to have Medicaid. And of course, depending on the states, you'll have certain differences of services. In most cases, you're not going to pay anything to use your Medicaid, with the exception, perhaps, depending on the level that you have, of paying for some prescription drugs. Now, if you qualify for both Medicare and Medicaid, Medicaid can actually pay for even your Medicare premiums. So Medicaid could pick up your Part B premium so that you no longer have to pay it. And that's why someone who is what we call dual eligible, which is enrolled in both programs, can be very well covered for all of their medical expenses. And usually it'll be at a very low to almost no cost, with the exception of maybe a small copay for prescription drugs. The last thing that I'll tell you about cost is that when it comes to long-term care services, Medicaid does have a cost. And the cost sometimes is what comes to your heirs, to your children or your grandchildren, whoever you're going to give your house to, etc. And the way it works is quite complicated, but I'll just give you the very, very simple version. Before you can get Medicaid for long-term care, you have to spend all of your money down to $2,000. You can have one house and you can have one car. And if you have one house, one car, and $2,000 and you need long-term care services, then you will be eligible for Medicaid to pay for your long-term care services. Now, when Medicaid does that, they are going to pay for your long-term care. But when you pass away, they will take your house and your car and they will sell it. And they will recoup the costs that they spent on you as much as possible. If there's money left over after that, which usually there is not, then that money will go to your heirs. So the cost oftentimes comes later. Now, for someone who doesn't have a house and a car, perhaps there isn't a cost, but I just wanted to specify that with long-term care, even though it appears that you're not paying anything to receive long-term care for Medicaid, there still is a cost. Okay, last but not least, we have renewal. And I'm talking about your plan renewing from year to year, etc. Now, over on the Medicare side, Medicare is for life. It's a for-life program. As long as you are paying your premiums, you should have original Medicare for the rest of your life, with the exception of perhaps someone with kidney failure. If you get a kidney transplant and now you're doing better, then you may lose your Medicare. But for most people, Medicare is going to last for their whole life. You don't have to worry about it renewing. It's just always going to be there for you as long as you're eligible. Now, however, if you want additional coverage, like prescription drug coverage or Medicare Advantage plan, they do have renewals and they need to be considered every year. Most of the time they can automatically renew, but you have to consider your plan every year. So keep that in mind when you're enrolled in Medicare. Now, over on the Medicaid side, things are not quite so permanent. You see, in order to enroll in Medicaid, you have to qualify for it. And if you ever move to a higher income bracket, you may no longer qualify for Medicaid in your state. It is based upon your income, and you may be eligible today and ineligible tomorrow. That's why it's so important to know your state's eligibility requirements, because one year you might have Medicaid, but without even realizing it, you might lose your Medicaid coverage next month or next year. Okay, so those were the 6 differences between Medicare and Medicaid. One more time, Medicare is for older Americans primarily. Medicaid is aid for low-income families and individuals. Now keep that in mind, and you shouldn't be confused between these 2 programs anymore. And remember, if you're eligible for both, you can enroll in both Medicare and Medicaid. If you'd like me to talk more about how Medicare and Medicaid work together, hit the like button. I'll add it to a list of upcoming videos, and if we get enough likes here, then we'll do that. And if you'd like to learn more about the things that Medicare does not cover, then check out this video over here. Other than that, thanks for watching, and I'll see you on the next one.